have an email from a reader who says, ICU ventilation and tracheostomy care is impossible with a spinal cord injury in ICU. Moving too much, not able to wean off the ventilator, and the tracheostomy due to the routine care given in ICU makes it hard for my loved one in ICU. Is going home with intensive care at home the best option here? My name is Patrick Hutzel from intensivecareathome.com, and today I want to break down the question from this, reader who's asking, is it best to go home for their family member with a spinal injury on ventilation with tracheostomy, because weaning them off the ventilator is going to be really hard in ICU due to ICU routines and no quality of life, really. So let's look at this in more detail. And your concern is very valid with a spinal cord injury, especially if it's a high level like cervical spinal injury. You haven't really mentioned what level spinal injury it is, but if you are talking about ventilation and tracheostomy, weaning is really hard. Maybe it's even impossible if it's a C1 or C2 spinal injury. So it really comes down to where the level of injury is. That also means that your family member probably has little or no control over the muscles needed to breathe independently. And that can make weaning off a ventilator extremely difficult or potentially even impossible. Add to that the constant stimulation from ICU routines, turning, suctioning, noisy surroundings 24 hours a day, no natural daylights, especially overnight, lights on, lights off, people around, difficult to sleep. And it can be very exhausting and even distressing for someone trying to recover in an ICU, especially long term. And also, often, from my extensive experience as an ICU nurse, day and night rhythms are disturbed, again, because of the routines in ICU, because of noise in ICU, lights on, lights off, depending on what's happening. So in that context, yes, going home with an experienced home care service like intensive care at home is a significantly better option for most patients and families in situations like that. And here is why. It is absolutely more comfort and more stability. A calm, familiar home care environment reduces stimulation and allows for better rest and healing. And of course, allows for a much better quality of life. For example, all of our clients have community access, right? And, compare that to an ICU where patients and their families are stuck in an ICU bed or ICU cubicle. Compare that to going home with critical care nurses at home, and then also having community access and improve the quality of life. Next, individualized attention and individualized rosters, because you're not sharing stuff with dozens of other patients. The care with intensive care at home is much more focused and much more tailor-made. Also, reduced ICU complications, lower risk of hospital-acquired infections and ICU delirium. Next, family involvement. You're closely involved in care decisions and daily interactions, and you can create your own routine. Next, same level of ventilation support. These services, like intensive care at home, provide intensive care level care at home, including tracheostomy and ventilator management with intensive care trained and critical care trained nurses only. So what else do you need to consider? You need to consider that the home is equipped and safe, power backup, suction equipment, emergency access, and so forth, but also, that all the equipment is there, like hospital bed, like hoist or lifting machine, right? Suction machine, backup ventilator, backup suction machine, oxygen, nebulizers, monitors, that all of it is there. But we can help you with that because we've set up many home care environments when patients go home from intensive care to a home care environment. And also, obviously, funding needs to be in place. But once again, like I've repeated here many times on this channel, funding is not even the problem, because an ICU bed costs $5,000 to $6,000 per bed day. Costs $5,000 to $6,000 per bed day. An intensive care at home costs around half of that. And obviously the quality of the home care team is critical, but because we exclusively work with critical care trained nurses that have a minimum of 2 years critical care nursing experience, and similar to an ICU, all of our staff, or a minimum of 50% of our staff, have a critical care nursing qualification, right? And you get the same level of care than at home. Now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. That means we are providing a genuine alternative to a long-term stay in intensive care for ventilation, tracheostomy, home BiPAP, home CPAP, ventilation without tracheostomy, tracheostomy without ventilation, home TPN, home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We're also providing ventilation weaning at home. We're also providing central line, PEEK line, Hickman's line, as well as port management at home. We're also providing nasogastric tube and PEG tube management at home. We're also using cough assist machines at home for airway clearance, which is especially important for high spinal injury management. And we're also providing palliative care services at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going into the emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our services cost between $2,500 to $3,000 per bed day. And we're freeing up the most sought after bed in a hospital, which is the ICU bed. But most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life at home is much improved, surrounded by families, instead of staying in an intensive care unit. With intensive care at home, we are currently operating all around Australia, in all major capital cities, as well as in all regional and rural areas. We're an NDIS-approved service provider all around Australia, TAC and WorkSafe in Victoria, iCare in New South Wales, NIISQ in Queensland, as well as the Department of Veteran Affairs all around Australia. Our clients and we as a provider have also received funding through public hospitals, private health funds, as well as departments of health. We are currently the only service provider in Australia that has achieved third-party accreditation for intensive care at home nursing. In 2025, we have been achieving this level of accreditation since 2012. No other service provider has achieved this high level of accreditation in the community and has created more intellectual property for intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. If you're at home already and you're watching this, or if you're stuck in an ICU, like in our case study today, or if you're going to a hospital NED all the time and you realize that you don't have the right level of support, I'll give you another tangible and real-world example today, very similar to the one I gave you a minute ago. One of our first clients when we first got started in 2012 was a client who was at home, initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after ventilated and tracheostomy clients. That is simply dangerous and negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with the cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at risk of dying if they don't have a team of critical care nurses looking after them 24/7. This is actually evidence-based. It's documented in our mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind would do that in a home care environment in the community? So this client found out about us eventually, and the ICU that he went back to all the time also knew about us and eventually reached out to us. And we were proving our concept with this client very fast. When we worked with the client, we sent him intensive care nurses 24 hours a day. And he never, ever went back into ICU ever again, as long as we worked with the client. And we were proving our concept there very fast. We can do the same for you if you're not safe at home, which includes the advocacy for funding that goes along with it. We have always successfully advocated for our clients, otherwise we would not be in business. The same is applicable for those stuck in an ICU, similar to our case study today, or if you're going back to ED all the time, reach out to us. We will help you make it happen for you as well. We can take you through the right steps, including NDIS, what the funding bodies and the advocacy that needs to go along with it. Which is also why we are providing level 2 and level 3 NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for nursing care for your participants and you don't know how to go about it, and what evidence to provide, I encourage you to reach out to us as well. We will help you with the right level of funding and with the right level of advocacy. We're also providing NDIS specialist nursing assessments done by critical care nurses with a legal nurse consulting background. And if you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, high-performing team of critical care nurses in the community, we are employing hundreds of years of critical care nursing experience combined. If you're looking for a career change, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, and in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again. And because they are so vulnerable and very special, that's why we need regular staff. So if you are looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building relationships with us and with our clients. And if you are an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it's much more cost-effective than what you are paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this, and you have bed blocks in your ICU, ED, and respiratory wards, or home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell. Share this video with your friends and families and comment below what you think about this video and what you want to see next. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.